Hello everyone, and welcome back to the channel. This is Dr. J, and today we've got the woolly mammoth wax plug. By the thumbnail, I bet you could already see that it's a pretty big plug, and it was all full of hair, and the name just kind of fit as I was thinking about what to title this video. It's an elderly gentleman, and he had complaints of hearing loss, and he was unable to complete his hearing evaluation because they just could not see his eardrums. And so more than likely a portion of his hearing loss is a result of this massive wax plug. Usually it adds anywhere from 15 to 20 decibels worth of hearing loss when you have an ear canal that's completely full of cerumen. You can tell that his ear canal is very hairy. Now, I've probably seen worse than his, but this kind of added to a lot of his problems. As the hair slough off or get trimmed, they go down into the ear canal and get impacted and combined with the earwax and old skin, and create these little concretions and make one heck of a plug, and can sometimes be difficult to get out. So here we're adding a little bit of collace, and you can see that once the collace is just in place, you manipulate the plug around, and I'm moving it top to bottom, side to side, front to back, trying to get the collace down and past and around the plug so that it will lubricate it, keep it from being so sticky, hopefully help detach it from the canal wall so that it will slide out much easier. Now I'd like to introduce a product to you today. Now, you've seen me use collace a lot. It works great in the ear canals in the moment when we're trying to get a little bit of lubrication, a little bit of breakdown of a cerumen or keratinaceous plug as we're trying to get it out, just to help the process along. But long-term ear care is something different, and that's what I want to kind of bring up today. Long-term ear care, where you use something either daily or weekly or twice a month or even monthly, and sometimes just as needed. There's some over-the-counter products out there. Now, I went to medical school with this guy, and I remember thinking that this guy was probably one of the smartest guys I ever met. We worked together, working our way through med school, and I was always kind of in awe of this guy. Well, it turns out that we both wound up being an ear, nose, and throat surgeon. He happens to work over on the East Coast, and like myself, we find that we have a lot of patients who need long-term ear care, and there's not a lot of really great products out there. Some that I've mentioned in the past include DRYNESS, which is DEBROX. You can use virgin olive oil, mineral oil, Johnson & Johnson baby oil. Well, he's set his mind to creating a good product that's available for everyone. And the name of that product is Senses. He literally knew exactly what was good for the ear, literally cooked this up on a stove until he got the ingredients to where they would work well in the right concentration of the different types of oils and stuff. I mean, we're talking about coconut oil, organic jojoba oil, vitamin E, mineral oil, organic black cumin oil. He had it tested by dermatologists. He had it tested by microbiology labs to make sure there was no microorganisms that could grow in it, and it passed with flying colors. And it is now available, after all of his hard work, finally it's available on Amazon. So I will leave a link to his product in the comment section below, but if you are in need of a good ear care product, then this is perfect for you. Now, let's get this woolly mammoth out. Utilizing the right angle hook, I'm able to start to get around the bottom side much easier now. As I'm starting to work it around, I am able to see that we're still kind of hung up on the top. So I reach up on top and I'm starting to pull this out, you can tell that it's really tight. The narrow openings of the ear canal, obviously at the very opening of the ear canal on the outer part, and then the inner narrowing or the isthmus as the ear canal starts to turn a little bit, it gets narrow there as well. So here we're able to just work it past that second natural narrowing of the ear canal and slides out into the opening, and this huge earplug, and it's completely packed with hair, and it just made sense that we call this the woolly mammoth wax plug. I mean, it was huge. No wonder he had so many problems with his ear. And as we go back into the ear, we can see that the ear canal is clear, and a couple small flakes there, but once we get him on this regimen of routine ear care with topical oils, he should do just great. We'll probably see him back in 6 months to see how he's doing. Thank you very much for watching. Appreciate you sticking this one out to the end, and we'll see you on the next video. Have a great day.